Is one of the most remarkable medical things, for lack of a better word, going on in this country. And we're going to explore medical tourism today. We are going to begin with Dr. Rome. Say it for me, because I don't want to say it. Judapa.
Yes.
You're with UCLA. You're
Yes.
a gastroenterologist?
Yes, I'm an associate professor of medicine at UCLA Medical Center.
And you're here at UCLA, but yet you're also involved in sending people overseas for surgeries.
Well, let me take a step back.
Okay.
I'm involved in working with physicians overseas and training and teaching.
Okay. An important distinction.
Exactly.
Right.
And so we have physicians from overseas who come and train with us at UCLA, and we go over there and work with them at their various university hospitals. And the patient care, whether it's patients from Asia coming to America or vice versa, that's really what's termed medical tourism. We don't like that term because it implies tourism rather than healthcare.
But there is an element
Yes.
of taking tours, having a little rest and relaxation while you're off having whatever the procedure may be done?
Yes, some people like
Some
to
people,
enjoy
yeah,
that,
yeah,
but
yeah.
From our perspective, it's really about the healthcare, and we want to focus on getting the patient well, and the tourism is a secondary thing.
And so, Dr. Judaba, what procedures would people go overseas for typically?
The medical tourism trend, I think, is focused around elective procedures, and that includes plastic surgery, dental procedures, and less involved procedures like minimally invasive gastrointestinal procedures, orthopedic procedures.
Orthopedic would be maybe, say, a hip replacement?
Hip
a
and knee,
replacement?
exactly.
Is a less expensive price or cost for the procedure, is that the main reason why people would want to go overseas?
I think there are two main drivers behind this phenomenon. One is price, obviously. If things cost $50,000 here in the U.S., oftentimes it's about a fifth of the cost, or $10,000. And the other driver is access. So patients who have to wait long periods of time to get on a wait list for a procedure, or their insurance company says it's a pre-existing condition and will not cover it, that's when these patients are seeking alternative options.
And what would they typically do? Would they come to their physician, or do they go off and try and plan it on their own? What do you recommend?
Well, I think from my perspective, it should involve their primary care physician, because if they go off on their own by doing an internet web search, one, they don't know who the physicians are overseas, and two, and more importantly, is that if there is a complication, there's really no one to look after them after they come back to the States.
And that's exactly the next concern. What do you do if something didn't quite work out the way it should have?
From our perspective, I think we have to involve the physician from the get-go. Now, you see your physician here in the States, they make an evaluation, and if it's appropriate and they can afford it, then we obviously would like to treat them here stateside. If they don't have the insurance coverage, then we give them the option. Would you like to take a trip overseas for the health care? In which case, then we can suggest different facilities, different physicians who are qualified in that treatment.
What are some of the countries that people would be likely to go to for one of these procedures?
Well, I'm from Thailand, and so obviously I know a lot of the physicians over there in Thailand, as well as the different university hospitals and private hospitals. There are many good doctors all around the world in many different countries, and I think that's really probably going to be based on the familiarity of your physician with those specific countries.
How well trained are physicians and the staffs in foreign countries compared to the United States?
It's hard to make that generalization, but I think for the most part, healthcare is a field in which physicians want to work to educate one another. I'm involved with many international conferences, and we get very skilled physicians from all around the world coming to the U.S. and vice versa. I lecture in Asia and Europe, and we see outstanding care. And the studies that they do show comparable outcomes.
You mentioned when we started all of this, Doctor, that you have people who come to this country for procedures?
Yes, so the trend medical tourism actually is a misnomer. Tourism in the sense of travel. So it is medical travel. And being at Northwestern for many years before coming out to UCLA, we were taking care of many patients from Asia and from the Middle East who would come here for procedures. And the driver there was that the quality of the care back then was not at the level that many local patients were satisfied with. So they would travel here, get the care, and go back. So I think that the issue of should patients travel for care is a non-issue. The major issue is, well, what procedures would be appropriate for travel?
And could you expand a little bit more on what those procedures might be? You had talked about dental sort of things, basically sort of a cosmetic sort of thing with the dental.
Yes.
And maybe some other cosmetic type of surgery, but
Yes.
serious kinds of things.
Yes.
What would some of those conditions be?
So I think from a physician perspective, you always have to look at the patient's well-being. That if it's a condition in which will require urgent care, or if there's a very high risk of having a complication, if there is prolonged travel involved, then you should not travel.
And it just dawned on me that
Yes.
when you take an international flight, they will often tell you, they'll warn you about blood clots that can develop.
Exactly.
And get you to get up and walk around. And that would have to be something that a physician would have to take into consideration, wouldn't it be?
Exactly. So even myself, when I have patients who I've cared for, they ask me, is it safe for me to travel? Then we have to find out what exactly their underlying conditions are, how long is the travel involved, and then if they were to have a complication in whatever location, for example, if they're traveling out to Alaska, I would say, well, if you have this serious condition, you probably shouldn't go up there in case something did happen.
Now, there are hospitals in Thailand
Oh, yes.
that are doing this, and do they tend to specialize in certain procedures, certain kinds of procedures?
Yes, there are many hospitals in Thailand that are of international standards, ranging from the university hospital and as well as the private sector. The one that most people have heard about is called Bumrungrad Hospital, but there are many others like Bangkok International Hospital, Simitivate Hospital that are outstanding.
And I wonder if they're set up specifically for the international traveler who's getting medical care.
Yes, I think that's what they've basically established their various programs to accommodate these patients. They have international interpreters of Japanese, French, Middle Eastern, Arabic-speaking interpreters. So they are, the facilities are quite impressive, and the physicians, I think, for the most part, are very good. I think the key from a physician, U.S. physician perspective is, do I know that doctor? Would I trust that doctor to take care of my patient? And that really is the key question.
But of course, that's going to be a problem for someone who's traveling here because you don't have enough time to develop a rapport, get to really know the person who's going to be cutting on you.
Yes, that is one of the issues that I think the whole industry has to address in a very thoughtful manner, because if the driver is just about saving money, I think that will get lost in the equation.
Yeah. I wondered, are medical schools in this country, are they aware of what's going on and helping to train American doctors to look at maybe a more global perspective on all of this?
I think that's been going on for many years, where even as a medical student, I did elective rotations abroad in Japan, in Thailand. And so I think at the medical school level, we try to teach that healthcare is not just about the U.S. Having said that, for practicing U.S. physicians, I think it is concerning to them that many patients will opt to go overseas for health care. And so I think there might be a lot of naysayers about this trend.
I wonder, as I listen to you, I wonder if maybe certain countries and their cultures in those countries might have better doctors or more thorough doctors. I can imagine a surgery in Germany, for example, or maybe Switzerland. It would be done with absolute precision, high level of technology and so on. Is that true? Is there a sense from country to country, culture to culture, different approaches to medicine?
I think it's hard to generalize in general, but in terms of Thailand, for example, they tend to be very service-minded. You know, they come from a culture that is very service-oriented
Sure, of course.
and tourism-centric, so that I think, for the most part, the patients that I've seen who've gone to Thailand rave about not only the healthcare, but the people, the food, the culture.
And there's always someone to fluff up your pillow. There's good food, all the things, the creature comforts that make healing go faster.
Yes, I think that's a very important aspect of healthcare.
So now the next time, and you know, knock on wood, God forbid that you should have to have a procedure, but would you yourself consider going off to have this done outside the United States?
Well, I actually already do, in the sense that I do it as a physician. So whether I treat my patient here or overseas, I think I'm still the same person.
But you yourself, if you needed a procedure?
And if I myself had a condition, I would trust my colleagues who I've trained with or trained under to treat me, whether they're in Thailand or in Europe or elsewhere in the world.
Well, what a confirmation of their skills and their dedication.
Yes.
Doctor, thank you very much for being with us, and we
thank you very much, Mr.
appreciate you helping us. It's Tony. Helping us learn about other ways that we can get medical care, make ourselves healthy.
Yes.
Stand by. We will have some information on how you can get in touch with all of the folks that you'll see on today's program. We'll be right back.
Your kitchen looks great. What did you do?
Well, I went to Anna's and got the curtains, rug, chair pads, and everything to set my table, all for under $100.
That would have cost
More than twice as much at the home store.
Anna's, where you get a lot more for a lot less.
It's a brand new day. It's a brand new day. You're gonna see your home in a whole new way. The great brand you're looking for, the new brands Ross has in store at Ross. It's a brand new day.
Ross has changed for the better with more of the top brands for your home. What hasn't changed? The same low prices.
At Ross, it's a brand new day.
You get a lot more at Anna's.
Don't you just love my new comforter set?
Sets like these are $100 at the department store.
Yes, but at Anna's, it's just $49.99.
$49.99? How do they do it?
Everybody's talking about Anna's.
Anna's.
Lost all control of what your kids watch on TV? Have no fear, the V-Chip is here and has been for some time. You select what TV ratings level is appropriate for your family. Set it, then don't sweat it, because you wouldn't want this to happen. As easy as using your remote, the V-Chip is built into most newer sets and is also available as a standalone. For more information, please see this website or call this number. The V-Chip, helping make TV safe for America's families.
Gotta get that. Oh, it must be here. Well, that's a nice picture.
Come on, Anna.
Okay.
Foreclosure doesn't affect just you. It affects your whole family, too. Call 1-888-995-HOPE for real help and guidance, because nothing is worse than doing nothing.
Young man rhythm got a hold of you too. I got a rockin' pneumonia and a boogie woogie blue.
For more information on Dr. Rome Jutaba, you can contact him through the website www.medsglobalhealthcare.com, and that's Meds Global Healthcare, all one word. The easiest way, though, to make the connection is going to our site, myfoxla.com. Look for the big Midday Sunday yellowish orange logo, and you'll find the link right there. We'll be right back, and we'll talk about some of the ways that you can actually pick up and travel and make these plans for medical tourism.
You loved them since the first time you heard them. Now see the Police live at the Hollywood Bowl with special guest Elvis Costello. And Good Day LA has your chance to win 2 prime seats. Just watch Good Day LA Monday. Look for the code word and enter it at myfoxla.com for your chance to win.
Honey, it's gonna be okay.
It's dead.
Maybe it's just that...
It's dead.
Well, we'll get you a new one.
It won't be the same.
You're right. Could be plasma.
Hey, your TV's dead.
I'm okay with this.
Now you can recycle it and keep California's environment alive. Visit erecycle.org for more.
When I joined the California National Guard, I never thought I'd be saving lives.
It's more than money for college. It's built my character and given me a sense of accomplishment. The Guard opened the door for me. Now I'm on a career path, and I'm the leader of my team.
I put on the uniform and have a whole new outlook on life. Country, community, family. That's what matters most to me. If that's what matters to you, go to 1-800-GO-GUARD.com.
Carlos shares a room with 4 older brothers. 0 members of his family have graduated high school. Carlos has acceptance letters from 4 universities. Carlos also has 1 mentor, and that has made all the difference. From mentoring to classroom programs to college counseling, for 30 years, the Fulfillment Fund has been empowering youth through education. To learn more about how you can make a difference, go to fulfillment.org.
Before you wind up in this, check this. Traffic info 24/7 and the only live rush hour webcast anywhere in LA. Real-time traffic, only on myfoxla.com.
This is Midday Sunday. We're talking about medical tourism, getting up and going to a different country for a procedure. In many instances, I would imagine, because the lower cost. Amy Holcomb is our guest now. You're with Planet Hospital.
Mm-hmm.
Planet Hospital. Boy, I think that name speaks volumes. You're helping people go someplace else to get the medical care they need. How do I go about this? My doctor, for example, has just said that I need hip replacement. What do I do?
Well, you would contact us and we would get your medical information, make sure that you're a good candidate. We do have U.S. doctors on staff that would make sure that there's not going to be any complications for your travel. We would make recommendations as to which countries have the best trained surgeons. We would take your x-rays and everything, and we would get a consult for you. Once you chose which doctor that you liked, we would set up everything for you. We could help you book airfare, the appointments. We have somebody that lives in the country that would provide transportation, concierge services, if you will, while you're there. Tours, anything you needed.
So, in effect, all I need to do is get myself to the airport, and you're going to take care of everything from that point on.
Yeah, we can. And a lot of people, if they've already been to the country, I mean, we welcome if they'd like to try and do their own, but we do offer that as a service, and there's no charge for that.
So this term, medical tourism, the tourism part of it, do people actually turn this into some sort of a recreational or tourist sort of experience?
Absolutely. A lot of people will arrive a couple days early. Maybe they're going to Costa Rica and they want to tour the rainforest. A lot of people will stay late. If you've just had a cosmetic procedure and you need to be there for 7 days, what do you do during that 7 days?
Yeah, you don't want to sit in a dark room in the hospital. You want to go off and experience where you're at.
Right.
You also handle surrogacies?
We do. That's a very big thing for us right now.
Tell us about that.
Pretty much we use India and Panama for our surrogacies. They tend to have great success rates. There's very little wait, maybe a 2-month wait, 3-month wait for the surrogate.
There are that many women who are offering themselves to be surrogates.
Well, you have to understand, like in countries like India or Panama, what they make for doing a surrogacy would cover their wages or their living expenses for up to 4 years. So.
I had no idea. You've mentioned Costa Rica, you've mentioned, I think earlier when we were talking, you mentioned Belgium. How many different countries are there? Or typically what countries are available for people who want different sorts of procedures?
It really depends on the procedure, which country, obviously there are certain countries that we would not recommend for certain procedures. There's certain hospitals that we would not recommend. We do check.
Do you want to mention what some of those, not necessarily the hospital, but the countries?
Like a lot of people will go over the border to Mexico for cosmetic, and usually it's not recommended. Now, I don't know if you're aware, but even in the U.S., you don't have to be boarded to actually practice. So a lot of... Yes.
You don't have to be, wait a minute, back up a little bit. You have to be an MD?
Yes.
Board certified. That's what you're talking about. Ah, that's right. Because you can have, I don't know, proctologists doing cosmetic surgery.
That's right.
Okay.
So a lot of people in Mexico will say, yeah, I'm U.S. trained, but that doesn't necessarily mean that they're trained in the function that you're going for. So we are looking at expanding that. However, a lot of the plastic surgeons in Mexico just aren't comparable in price or the education. We work with countries such as Panama, El Salvador, Costa Rica, Mexico, Belgium, India, Singapore, Thailand. I noticed he said Beauregard. We do not work with Beauregard. And there are certain reasons why we choose, each of the hospitals that we do, or each of the doctors in our network.
Belgium, you mentioned Belgium. That's the only European country that you mentioned. What do they have that the other countries don't have? And I would imagine they would be more expensive.
They are because of the euro. However, their prices are still half of what the U.S. is, even with the euro inflation. But they do have, especially orthopedic, they have one of the best in the world. He's pioneered a new procedure called hip resurfacing, where they actually don't cut the femur head when they do the replacement, like for a hip. Also, the implant doesn't go that far into the bone. Now, okay, the FDA recently approved it in the United States. Do you want to be on a one-year waiting list paying $40,000 for a doctor that's done 200, or do you want to go in 2 weeks to a doctor that's done 3,000 that actually pioneered the product for half of the price?
So what do you say to people who come to you and have concerns about the quality of the training of physicians in foreign countries?
Well, I think people have this predisposed position that U.S. training is better. The majority of our doctors are U.S. trained. We even have Harvard trained doctors. So, we try to reassure them about their training and their education. However, the best way is to give them references of people that we've already had come through our network, and they can talk about their experience.
And of course, those would be people who had positive experiences. Do you get people who have negative experiences? And if so, how do they handle them? How do they resolve them?
When you say negative experiences, usually a negative experience would be, obviously you're not going to meet the doctor sometimes before you go in. So we all have communication styles that are different. Maybe they didn't like a bedside manner or something like that.
But you could have that problem in this country.
You could. So we try to accommodate them as best we can. If there's billing disputes, they have us on their side. Obviously, we send large volumes of patients to them, so they're more willing to work on a billing dispute with us than they are.
But respectfully, it's not billing disputes that I'm concerned about. I'm worried about if I get that hip replacement and I get home and something's not the way it should be.
Okay, well, we have doctors in our network in the U.S. that you could definitely go to. A lot of our foreign doctors also, you can send them x-rays and they'll do consults as well. They've obviously trained in the U.S., most of our doctors, so they have colleagues that they work with, and we have network doctors. We have not had any really negative experiences.
And if I want to have, what's the most lavish tourism part of a procedure that you've encountered in your time?
Most lavish?
Most lavish, I don't know, you're going to India for some procedure and you decide to take 2 more weeks and go see the Taj Mahal and the Ganges and so on.
Oh, absolutely. People do that all the time.
Yeah.
Taj Mahal is very big, especially if you're there for surrogacy and you go to pick up the baby when the baby's born. You're there for 2 weeks waiting for DNA, passport. You might as well see the country a little bit.
Can we talk a little bit more about surrogacy?
Sure.
How do you connect with a doctor and a surrogate in India, for example? They would come to you, and you will connect them?
Yeah, what would happen is they would come to us. We would give them like a lab requisition to say we need this type of testing, HIV, hormone levels, sperm counts, anything like that. And then the doctor overseas would give them a consult and say you are a good candidate or you're not. And then if they decided to move forward, they would be given, say I'm a male, I'm a single male, I want to go have a baby but I don't have a female. We would give them the profiles of what donor eggs are available and allow them to choose. And then we would proceed from there. They would get regular correspondence from the doctor, and we would give them step-by-step details.
The fertilized egg is sent over to India. How?
No, we don't ship fertilized eggs to India.
So how does that process then happen? It happens in India?
It does.
Okay.
Fresh is always better.
Okay.
So they'd actually cycle the person giving the donor egg to match the time that they go over there. So they would want to match the menses of the surrogate. To have the best results, and that's why they have such great results.
Okay. And then the donor comes back to this country and waits the 9-month period?
That's correct.
Okay. Wow, it's fascinating. the sorts of things that are going on. And it's Planet, your firm is called?
Planet Hospital.
Planet Hospital. We'll have a website for you when we come back, right after these messages. I thank you for being with us. And please be with us. Stick around for the next 2 minutes and we'll be right back.
Well, howdy, I'm Cal Worthington of Worthington Ford. Now, here are today's TV specials at Worthington Ford. If you see one you like, come on out right now because they sell and they sell immediately. Look, a brand new 08 Ford Focus for $10,900. A brand new 08 Ford Mustang for $16,900. A new 08 Ford F-150 Super Cab will knock you $11,000 off of the sticker. An 05 Chevy Aveo for $69.50. An 06 Ford Fusion for $10,900. An 04 Honda Accord for $99.50. An 06 Nissan Sentra for $89.50. An 05 Pontiac Sunfire, $79.50. An 06 Ford Explorer for $13,900. An 04 Dodge Ram half-ton for $99.50. An 05 Dodge Caravan for $89.50. An 06 GMC Sierra half-ton for $99.50. An 05 GMC Canyon for $99.50. Hey, and $95 down is all it takes. Come on out now. Worthington Ford, 2950 Bellflower Boulevard in Long Beach, and we're open till midnight.
For more than 100 years, Children's Institute has helped children recover from the trauma of abuse, neglect, and community violence through our proven and effective programs. We prepare them for opportunities in life to grow and to flourish. We know that traumatized children can recover and succeed. Join us. Give a child a chance. Please visit our website or call Children's Institute at 213-385-5100.
Hi, I'm Jimmy Smits, and I want to talk to you about 5 Acres, a very special place that's been restoring the lives of abused and abandoned children since 1888. Find out how you can make a difference in so many ways, whether as a mentor, a foster, or adoptive parent, or as a special friend. Please call 5 Acres today at 626-798-6793 or on the internet at www.5acres.org.
For more information about all the things that Amy Holcomb has been telling us about, you can go to www.planethospital.com. Dr. Judaba, his website, you can find him at www.medsglobalhealthcare.com, and you can find the short link. The quickest link is our site, myfoxla.com. Dr. Judaba had been talking about traveling and the fact that some people shouldn't travel. Do you cover that sort of thing, and what do you do?
We absolutely do. Our U.S. doctor would check for that. Such as if you're obese and you're over like a 30 BMI, we wouldn't recommend that
BMI?
Body mass index.
Okay.
We wouldn't recommend that you would fly to countries like India. And if you did choose to, then we would put regular stops in there, make sure that you got circulation so that you didn't have any clotting issues.
With all the groundings at American Airlines this week, have you had people who have not been able to get away?
You know, it really hasn't affected us. However, I just got back from Panama, and I happened to not be grounded. But there was a lot of layovers.
I'm glad you're back. And we're glad that you were with us. We'll see you back here next week.
Old Aunt Jane heard the rheumatism boogie, nearly went insane. He forgot his rheumatism and his 3-day gout. Janie grabbed old Ebenezer and we heard him shout, the rheumatism boogie, do the boogie. Oh, the rheumatism boogie, do the boogie. The rheumatism boogie makes you feel like you're young again. You'll do the country shuffle and the Suzy Q, the jitterbug special, I'm telling you. It makes you start to shimmy and you want to shake.
Hey honey, this department store has sheets for 50% off, and this home store has a coupon for 20% off.
That's nice, but I don't need department store sales or coupons. I shop at Anna's and save money every day.
Really?
Anna's, where you get a lot more for a lot less.
The Fox 11 Energy Team reminds you that small actions can have large benefits.
Use the stairs instead of the elevator. Once a week, carpool to work or school. When you're using your computer, don't print out a document unless it's necessary, and whenever possible, print on both sides of the paper. Finally, turn off the lights when you leave your office. Remember, it all adds up. That's the power of E.
Learn more about what you can do. Watch Fox 11 News or visit our website.
Anna's dares you to compare.
New beach towels?
Aren't they great?
I've seen them for about $6 at the department store.
Well, I got them at Anna's for only $2.99.
Just $2.99?
Everybody's talking about Anna's.
Anna's.
Where you get a lot more for a lot less.
Filled with never-before-seen footage, this Family Guy episode deserves another look. Get ready, fatso.
Tonight at 9 on Fox 11. The following is a sponsored program. KTTV is not responsible for the claims made by the sponsors.